Time is now 7 o'clock. I'm going to call to order the regular meeting of the Tilton Budget Committee for November 28, 2018. We're going to start this meeting with the pledge of allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And I thought that Tim was going to preach. He was back there at the pulpit, so I thought he was ready to give a sermon. All right, the next order of business are our meeting minutes. Everybody have a chance to review those?
I move we accept the minutes. Second.
All in favor?
Aye.
Opposed? Abstained. One abstention. And we will go right into our first guest for the evening. I don't see them. Island Concert.
15. Who would they accept?
Chris Meinhold.
Oh, okay.
Well, before that, we have a request, so we're going to bring this up and we can discuss it. From Old Home Day, they would like us to waive their coming in. Northfield Budget Committee did waive their appearance, so they're requesting us to do the same. It's level funding, so they're not asking for any more. It's Old Home Day. So I'm going to open that up for discussion.
That's fine.
Any other comments? Well, I'll entertain a motion
Motion to approve?
then, to waive.
To waive the,
All right. There's a motion on the floor, is there a second? Second. All in favor?
Aye.
Opposed?
We have a discussion on that. I just was curious. I kind of missed what we were doing.
Oh, I'm sorry.
We're waiving.
Old Home Day wants us to waive their coming in
Okay.
to present to us, and their level funded is what
Okay.
they
I
asked
thought
last
that's
year,
what- I
and
thought
it's
I
something
saw
that
it. Yeah.
we've only had 1 year that there was an issue,
Yep.
because they didn't, and this year they did provide the necessary financials, so I don't think there's any question. It's something that benefits our town a lot.
Okay.
Okay. So, all in favor again?
Aye.
Opposed? Okay, so be it. So, Johanna, would you please let them know?
I will.
We'll wait for a few more minutes. No one's here, so. You didn't hear from Island Concert to the effect that they didn't show up? Someone asked me the question, and it's a good time to discuss it, as to what Partnership for Public Health is. If you recall, last year, a group came in, and they had requested funding, and I believe they came into the selectmen first, and that's where I first heard about them. And they asked to be funded, and the selectmen sent them to the budget committee, and we sent them a letter saying that they were too late because it was past our deadline, but that they would be happy to entertain a presentation this year. So they'll be coming in. That's what the Partnership for Public Health is all about. I'll follow up on some other work. Did you get all the information from Public Works?
yeah, sort of.
What didn't you get? Did you?
I don't know, we got like the end lines of what they spent, but not what was spent on, I guess the detail of what they bought, I guess, on some of the things.
Well, I think that would, the only thing that would do that would be an invoice, and I don't,
Yeah, actually, I'm glad you brought it up. Part of that email that was sent to you guys had the listing of all the expenditures, a report, PDF report. But then there was also a folder, and in the folder were a list of all the invoices that pertain to one of the expense lines that isn't even in the Public Works budget. It's actually in the police budget. It's for all the vehicle maintenance for the cruisers. And I pulled every invoice that pertained to to that listing. So there were two reports. There was a year-to-date report with all the expenditures for Public Works, and then there was a year-to-date report of with the detail showing all the separate line items within that auto parts line for the PD. And then there was a folder which you can link into and see all the individual invoices. So you'll first see a check, and then behind the check you'll see the invoice and detail behind it.
Well, I saw the invoices for PD. PD was very thorough, but the only thing I lost was the invoices that were for the Public Works vehicles for that maintenance. I guess those weren't in there, or I just didn't see them, but.
No, so that would be a different line.
Okay.
So what I saw and what the chair had expressed to me was an audit of all expenses, which it took me about an hour and a half just to do the PD one. So it was, I needed to sort of get a better idea of the scope, because this time of year I'm just flat out. So if it's the Public Works vehicle maintenance,
Yes.
so I can do the same thing for that.
Sorry
No, that's
to
okay.
loading it on you. It'd be a good time of year.
Yeah.
And you probably do.
Yeah, obviously, I appreciate it.
So, but yeah, those vehicle maintenance lines, I can do the same thing for that.
Okay. Thank you so much.
Mhm.
And also keep in mind that before the mechanic working for Public Works was doing that, it was being farmed out to like an auto serve.
Yep.
Or whatever, so there's a big difference in the prices you'll see there, I believe.
I'm trying to look back up again.
And the American Red Cross did send the information report, especially from them. Did everybody get a copy of that?
Yes.
Well, I would move on to the next, but there's not a next here, so.
When they do 7:15.
Yeah.
Well, Island Concert Class, yes.
Oh.
We usually have people, I'm not sure.
Sure.
Last time they came like right at the time too. Last meeting they came kind of late, especially the 7:30 people.
Jim, do you want to start with, you want to start? No?
Start.
Well, you said you had some things to tell us, though.
Oh, no, I just wanted to clarify the scope of that in the
Okay.
minutes, that's all. I guess the only other thing would be, in terms of the target for the selectmen's presentation of the budget to the budget committee. Right now, the earliest would probably be December 19th, which would be the Wednesday before Christmas. That'd be the very earliest. More than likely, it'll be after the Christmas break. It just depends on how quickly we finish up. And also depend upon your holiday schedule, when you're going to meet.
Could we do that right now?
Is this the meeting that we missed?
The 19th is
Or
the
are we
makeup. Yeah.
oh,
It's
The 19th will be,
You're probably not meeting the 26th, is that right?
Well, no, that's, we won't be meeting the 26th. I'm just trying to pull up in December, and nothing's loaded.
are you on the internet?
No, I wasn't, that's why. Now I am. So I would say right now, we will not be meeting Christmas week. Is everybody agreeable to that?
Absolutely.
Sure you don't want to meet Christmas Eve?
I'm not the Grinch.
Well, you have a lot of toys to put together this year.
Yeah, I'm not gonna give anything. It makes a lot of difference. Just give him some box or something. His son just barely turned 3 months, or he's about to turn 3 months. Next week. A couple of years before the pressure's on.
New Year's Day is that Tuesday, so I don't see any reason why we can't meet January 2nd. Anybody have any objection to that? Any reason why we can't? December 31st is a Monday, which is New Year's Eve. New Year's Day is the 1st, and then that Wednesday is the 2nd. And I don't see any reason we can't meet.
Good.
Okay. So that'll be just the one that we'll miss in December.
Good.
Chris is always here right on time. He's, surprised at that.
You here?
Oh,
This would be really good.
It's quite the volley.
For a minute, seems I'm, DNS probe finished, no internet.
If you want to try to connect to Town Tilton,
Town,
Tilton,
DOT.
it's, yeah, that's what's connected.
I just texted Allison to see if Chris was going to be attending.
Did you change it?
yeah, I had to reconfigure, where was it?
I think I met with 1%.
Oh, you're fine.
You want to do mine with me?
Won't you add singing the Star Spangled Banner? To our opening.
It's gonna have to
Yeah,
be
well,
the
we did.
words. Done with the wind.
We've never had this problem before. They're always, you're waiting. They're ready to come up.
Really?
Do you still have the policy if they're no show, you don't fund them?
Did we wait the whole
I
time?
hear somebody.
Hello.
Hello. Well, you're the first one here, Sheldon.
How you doing, Jane?
Good to see you.
Good night, how are you?
Come on up and join us if you're ready now, and you just got here. We'll let you settle in a while.
Okay, let me just take. A lot of stairs there.
We work for Public Health Agency, we're having.
Yeah, we're going up on the stairs.
Every water. No, okay, we'll come up.
We'll pull up. Or do you want us to?
There's a couple of chairs.
Okay.
Pick up those rolls on it.
Am I late?
No, you're the
Oh,
first,
okay,
you're
that's what I
early.
thought. Okay.
Yeah, we're
You're
still
the
waiting
first
for
one
our
to
food.
go now. So we just talking, what can we do? We're gonna read Moby Dick, maybe that would. Okay, glad to see you. And there are new members of the Budget Committee, so I'm gonna start on my left, and we'll start with Bill, introduce ourselves, and then you can introduce yourself.
Bill Lawrence.
Theodore Gargano.
Jane Alden.
I'm John Scanlon, year one.
Christine Nowitzki.
Dickles.
I'm Shelley, that's Carissa. Do you want us to talk a little bit about our organization?
Yes, please do.
Okay, well, we're from the Partnership for Public Health. I'm with a public health agency. We're based out of Laconia, but we serve 15 cities and towns known as the Winnipesaukee Public Health Region. And Tilton is one of the communities that's in our catchment area. And we do a number of programs. We work a lot with the town of Tilton. We run an emergency preparedness program, and I know we just recently completed a drill over at the prison vet zone with trying to develop an emergency plan in case we have to evacuate that particular building, how we would do it, and we work closely with the police department and fire department to execute that. I don't know, Jane, were you involved in that at all? No, but we do a lot of work with substance misuse in the school department. We work with Winnipesaukee Regional School, High School. We work with the police department. We're involved in the drug take-back programs and do a lot of community education around substance misuse and suicide prevention. We are the coordinating agency for the Community Health Improvement Plan. And I know when I was here last year, I talked a lot about that plan. And we meet down at the Franklin Community Center, and we have a group that meets every month, and we have a couple of folks from Tilton that are involved in that. And what it is just trying to move the needle to improve in a number of public health areas in the Winnipesaukee region. Now, one of our biggest programs that we have at the Partnership for Public Health is the Service Link program, and that is the program that we've proposed a $2,500 request to help support those services. We do have a huge impact in Tilton as far as Service Link goes. And I'll let Carissa, who is the director of the Resource Center, tell you a little bit more about what Service Link does and all the day-to-day stuff and about some of the people that we're helping here in the Tilton area. So, Carissa?
Does anyone ever heard of Service Link before?
Oh, good.
You're not old enough. You're not old enough.
That's okay. So service links are federally designated as New Hampshire's aging and disability resource centers across the state, so there's one in every county. I oversee both Belknap County and Carroll County, so we're serving residents in both those communities. We receive funding through the state of New Hampshire, and as things typically go, we are level funded, if not have our funding cut every year. So this past year, we received a $15,000 up to our budget. We serve traditionally folks who are aging, folks with disabilities, caregivers, veterans, in that group. However, pretty much we handle everyone who walks through our doors. We're not going to turn anyone away. I've had people speaking different languages just kind of dumped on our doorstep who are homeless and just sort of worked with our community partners and just figured out what we need to do to get them settled and get them into a safe place. So, big thing we're taking under right now is it's Medicare's open enrollment. So every year from October 15th through December 7th, my service link staff and staff from service link across the state are the only entity within the state of New Hampshire that are certified with Medicare, the Centers for Medicaid and Medicare Services, as a state health insurance assistance program. So that's a certification that we have. It allows us to access Medicare in ways that other people can't and give our clients completely unbiased information on their healthcare choices. So specifically right now, we're looking at prescription drug plans and Medicare Advantage plans and helping folks compare those plans and save money. Just the other day, believe it or not, we helped a consumer save $38,000 on our health insurance costs next year just by switching plans, which is pretty incredible. And as of last week, just the Belknap County office alone, and we have one what we call a shift counselor, so someone who's meeting directly with clients and comparing those drug plans. She's already saved the clients in this community about $100,000. We don't have specific Tilton numbers now, but you can imagine our cities and towns, the consumers that we've seen, the money that we've been able to save them. So it's a pretty big project that we undertake every year. And that's across the state. We're not alone in that. New Hampshire, I think we save about $3 million each year for folks across New Hampshire. And that's again with custom funding and everything else that, the demands get higher, the funding gets lower. But that's nothing new for anybody. So this past fiscal year, I brought a few stats that I pulled. So last fiscal year, so July 7th of last year through this year's June 30th, we served just about 250 folks in Tilton. Let's see here. Primarily phone calls, so almost 200 phone calls, quite a few home visits, and quite a few folks came in for office appointments. But a lot of what we do is over the phone. The biggest things that we're serving folks for in Tilton specifically are for what we call long-term care options counseling. So we have folks who are calling us who are caring for loved ones or who are taking care of themselves at home, who need options to understand how they can age at home and how they can fit in with their community, given that they have diminishing health, they have increasing health needs, and they don't have any resources to take care of themselves. So how do they age at home? How do they avoid going to nursing homes? How do we get supports and services in there so that they can be happy and healthy where they are? And in the end, that really saves everyone money. We're not overrunning our nursing homes, and it's far cheaper to help somebody remain in their home than to put them in a facility and have the state of New Hampshire try to support that. So all in all, it's good for them, and it's really good for our state budget, ultimately. The other thing that we did a lot with in Tilton for your Tilton residents is caregiver counseling. So that's working specifically with caregivers who are taking care of loved ones. We'll talk to any caregiver, of course, and help them connect to services, but we also are a partner with the New Hampshire Family Caregiver Program here in New Hampshire. So we receive funding from the state to provide respite grants to caregivers in our county. We received about $60,000 last year to do that, and we spend it down to the penny each year. And those are for folks who are caring with someone with Alzheimer's, dementia, or any other illness. And there's some kind of, there's qualifying age things and things like that. But we are seeing a big rise in grandparents who are second-time around parents, who are caregiving for younger kids, who are just coming to their doorsteps because, unfortunately, their biological parents are unable to care for them. We're seeing huge, dramatic increases in that. So that's something that we're seeing big increases in. Believe it or not, one of the biggest things that we did for Tilton is supportive listening. So we have a lot of clients call us who are just having a bad day. And there's not really a whole lot that they need, but we've talked to them before. They know they can talk to us, and they call us, and we listen to them. And maybe we help them know that there's a free meal, or we help them connect to a service, but really what we're doing is just listening, which we do categorize on here because it does take up some of our time, and that's something that we're more than happy to do with anybody who really calls us. So yeah, that's in a nutshell a lot about what we do. Just shortly too, this year with our Caregiver Respite Grant Program, we're serving about 10 people in Tilton on that grant who are receiving active respite grants. And just this week, we're going out and doing home visits with 2 more Tilton residents who are going to be put on a wait list because we're already at funding.
So maybe just saying a little bit of what that respite really means, like
Sure.
an example of that.
Yeah.
what
Yeah,
it is.
absolutely. So, I'm not sure, and you don't have to say, but if anyone here has ever been a caregiver, even short term, it can be very time consuming. And there's a lot of, just emotional stuff that goes into taking care of a loved one. So when you're taking care of a parent or a spouse or a child who has a chronic illness or who has Alzheimer's dementia, that's 24 hours a day. Sometimes in addition to your full-time job, or you've had to stop working because you have no other options for taking care of them. If you're taking care of an older adult, we don't have any adult day centers here in this area that provide respite care for folks. The closest one is Bristol or Wolfboro, and I think the one in Concord just shut down. So those centers where folks can find a safe place to bring their loved ones so they can just go to the grocery store and shop, or sometimes even just take a shower if someone has dementia and they tend to leave their home and wander. Or if they're taking care of a grandchild, we help with the grandparents, we help them get backpacks, clothes, even school supplies, but we'll help send the kids to a camp or to dance class after school so that the grandparents can get some time. And quite often, the grandparents aren't able to do those kinds of things because they're already living on fixed incomes. They're on Social Security, they're trying to make their own ends meet in the world that older adults have to do now with affording health care costs and prescription drugs and rent and everything else, in addition to all of a sudden being parents essentially again. So we really try to provide a break with those grants, and that's ultimately what it's for, is to just get a little bit of a break for folks so they can have just a little bit for themselves and not be a caregiver for a couple hours a week.
So how do you market yourself?
Mostly word of mouth, but ServiceLink, we are, our fiscal agent is the Partnership for Public Health. We are a program of the Department of Health and Human Services through the Bureau of Elderly and Adult Services. So all of our operations are through the Partnership for Public Health. We are engulfed in their work. Within our CHIP, we have aging initiatives and supporting caregiver initiatives, so that work goes pretty much hand in hand together.
We have, there's an 800 number that people can call so they can, for ServiceLink, and then it will be routed to us. We also have a lot of information on our website, and that's really, I think most people now are going onto the website, and we're in the process now of, reinvigorating our website, so we're going to have a new website in February.
So
And
you're linking caregivers to support for them? Is that what it
Yes,
is?
yes.
Yeah,
I'm just wondering how they get,
how the caregivers,
how they find out about
A
it.
lot of community partners, a lot of social workers at the nurse's offices, hospitals. We try as best as we can to go around and we hit up a lot of the laundromats and places where we know folks venture.
senior center. And
Senior centers a lot.
We,
I mean, are you on the state, there's a whole list of hotline numbers for the state?
yes,
Are you
yes,
on that?
yes, we're on that. And we also have, as part of, I'm not gonna get into it because I know we don't have a lot of time, but part of our, remember I mentioned that we have these meetings in Tilton once a month, and that's the Winnipesaukee Public Health Council. And each of our areas of work, we have a work group, and we have an aging and disability work group. And the aging and disability work group have people from throughout the region that work in this field, people from the VNA, people, all of those people are together working with us. So they are getting that information from us as part of their participation in our work groups and in the larger Winnipesaukee Public Health Council meetings. So that's where, a lot of it comes out from the healthcare facilities, that's where the word comes out as well.
And do you train volunteers?
We do have volunteers.
How many do you have in Tilton?
We actually don't have any volunteers from Tilton. It's hard to get volunteers.
Yeah, it is.
Right now, we do have a volunteer who, she's not from Tilton, she's from Guilford, but she's actually in her 80s and she's started volunteering with us. We'd love more, so if you know any.
I mean, do these people operate phone lines, or do they go and actually do work?
It depends on what they're
I
interested
mean, it
in.
looks like it was in here that you have caregivers that work for no pay.
No, nope, I'm not sure what you're specifically looking at.
That one.
Oh, you know, the caregiver one.
Family caregiver, informal, unpaid caregiver.
Yeah, so we don't, that,
And those are the people you deal with?
we're working with the informal
Okay, so they're like,
caregivers.
yeah, your children,
Yeah, so a lot of it, I just was doing a report and primarily we're working with husbands and wives taking care of each other as they age. We're taking sons and daughters who are taking care of older parents, who are aging in the area. And I'm not sure if folks know, but New Hampshire is the second oldest state here in the country. We're tied only with Maine for number 2. So,
Look at the gray hair around here.
it's time to color.
That's why I wear a hat.
only ask about your 15 towns and not all of them give to you. Why is that?
Because we just started asking, we started realizing that we can't just rest on our laurels and just can't wait for, if we sat around and waited for state funding, you know, it'd be a long wait, because, I mean, since I've been at the agency for almost 2 years, I mean, we've had some surprises with funding. Last year it was 50,000 cut, and this year it was like $20,000 cut. So we're getting cut back, so we need to find more revenues. So we're doing a lot. We've developed a fundraising program, which we've launched. And also we are asking, I know we said in the town of Belmont, they gave us 1,000 last year. This year they gave us 2. We are confident that we're going to be getting something from Meredith. We've asked Meredith, asking Tilton, and then we're going to be asking 3 more towns. So it's a slow and steady process, but we'll never get there unless we start. So that's why, and you know, Jane, I've been coming here for 16 years. I was just thinking on the drive down from when I worked previously and to this job the last 2 years. So, I mean, it's tough, but we've got to ask.
How much are you guys asking for, by the way? Sorry.
2,500.
2,500?
I correct me if I'm wrong, but originally it started out you were mostly federally funded, is that not correct?
We're primarily
It's still
state.
more
But you
Oh,
were,
yes.
but you were
Two-thirds.
almost
80.
entirely federally funded at one point, I believe.
Our organization, it probably a
Yeah, a
while
long
ago,
time
but
ago.
now it's probably like 80.
Yeah, but I'm just saying that, and then those funds were just dried up all of a sudden. Because I know you come to the senior center and you're very helpful to seniors. I heard about you first, not from Louisa when she was at Service Link. But I heard about you from another senior who said that you had been very helpful in deciding what plan to go on in Medicare. That's how I found it, I got to know about you. And all of you are too young to do that, but once you hit, so that you're eligible for Medicare, it can be very confusing when there are all these times that, expires, you gotta get your meds by a certain time, and you don't know which plan to go with, and one charges you so much, one no deductible, another one $2,000 deductible, what do I do?
We make a whole job out of that.
And they make,
One person does that,
but
yeah.
seriously, and they do save people $300 and $400 at a whack. It's amazing, because they have everything on a computer. And your website is much improved, so that now I don't have to go up to Service Link, I can do it myself on the computer. But
Good.
so I do know that you serve quite an audience.
Yes.
So any other questions that people have?
This is a joint meeting, right? Okay. Pat Constantino, one for selectmen. We have 2 other selectmen here too. 4 actually, 4. So my question is, I mean, I've been familiar with Service Link for many years. But, and also Shelley and her work, but not with the Partnership for Health. It sounds to me, I mean, they do phenomenal work. However, you're the state fund from Service Link, and they're not giving you the funds, so you're coming to the town for the funds
Well,
through Partnership for Health.
They're cutting back our funds, but
Right,
we
so-
want, we want to be able to maintain the services that we're providing.
And I get that, but it shouldn't be on the backs of us now to supplement that. It's, here we go again one more time for
Right, no,
unfunded mandate, I'll say it
Yeah, I know what you're
an
saying.
unfunded mandate, again, because
Right.
they're not under,
And-
because they keep slashing the elder care budget, like health and human services like crazy, and now it's on the backs of you folks to do that. But not all the towns are going to help fund this, so you're relying on certain towns
Well-
to buck up and say, you know what, I really need you
Well, we're
to
hoping-
help us.
Right.
And you, 200 calls, over 200 calls, but you're not really helping 200 people until, you know, they're calling you to ask a question.
We have caregivers in Tilton, and we have had we do home visits for people in Tilton, and we are providing some level of, a good amount of service in the town. But I know what you're saying, and I know your frustration, and trust me, my frustration is, that I can't think like that, because all I can think about is how am I gonna raise funding
I
to
have to
support,
think
yeah.
like that though, because
Yeah, right, no, I know.
all of those elderly people that you're referring to, and the people that we sit with, on a weekly basis and give our own unpaid respite care to, we have to, they're moving out because there's nothing in Tilton for them. And they can't afford their taxes because they're moving out. So when we say $2,500 to this outfit, $2,500 to that outfit, we have to think in those terms. And the State Department has funded you for years and years and years and years. The fight is at the State House for your money, for Service Link. It's a tremendous need in our community. It's been a tremendous help in our community. You need someone to advocate for you from each one of the towns and say, we need this in our towns. 10 people from every town should go down to the State House with you and fight. I'll be one of them.
Please,
And
I would love
I'll be
that.
one of them, but to come to the town of Tilton and say we need $2,500 to fund something that the state really wants, and trust me, I'm all for Service Link.
Sure.
That's not the point. The point is that you're asking us to foot a bill that the state should be footing for Service Link. And, and I get that respite care. I gotta tell you, it is so needed in our town. It is so needed in our town. But we can't keep paying for something that our state should be paying for. Our state should be paying for. Pretty soon it's gonna be on our welfare department. So it's terrible. It's disgusting. But our elderly people are moving out because they can't afford our taxes. And for every $2,500 that we sit here and approve, it's, $2,500 they can't afford. So I don't mean to be the.
No, and I know,
devil's advocate
well,
on this one.
we're here just to present our agency, because we know we don't want to be relying on your philanthropy. We don't want that, but, we want to be considered. I know, I've been coming here a long time, and I know the agencies that you give money to. I know there's agencies that you give money to that might not even show up and spend their time coming in here and telling you about the work that they do.
Not anymore, we don't believe that.
So I'm hoping that you would at least, value, you haven't given to Service Link in the past, but I'm hoping that at least by this meeting, you'll understand more about the work that we do. And, so maybe it won't be 25.
I want to hear more about partnership for public health without the Service Link link to it.
Okay, and you have enough time? I can tell you, Pat, you want to sit together, I'll tell you all about it.
I would like to get together with it because I think it's important.
No, I'd like to, because last year,
that you do.
because last year I came here and I told you all about the community health improvement plan, and it's a lot, it's a mouthful, but we are working together with all these communities to, we have 8 different priority areas, and we have 8 different work groups. I mentioned the aging and disability work group, but we also have an emergency preparedness work group. We have a group that's working to improve access to behavioral health. We have a work group we have a suicide prevention work group. We also have a substance misuse prevention work group. So we have 8 different preventing childhood obesity. In fact, I got a call yesterday from your town manager, who is working on a grant application, and we're going to be doing a memorandum of understanding about, they're going to be adding some hiking trails
I think, in the community. So we're kind of involved in that healthy eating, active living initiative. So the Partnership for Public Health, really, we're an organization that's just committed to making this community a healthier and safer place. So people are going to want to move here. People are going to want to stay here. So so we have all of these things that we're working on just to kind of help the overall, the overall community, be healthier and safer. And but I would be, it will take a long time, I can tell you. I would love you to be involved in one of our work groups.
We'd love to have you. Jim Wells comes over from Franklin for my work group, and he has some, he brings insight from the other side of the Winnipesaukee region, so it's good to have. We need those voices.
Is this something like what Twin Rivers did?
Well, Rick Silverberg is very involved and he's very involved in the council. He and I are like chair up this Winnipesaukee Public Health Council. So yes, it's very much like that. So what we do is we collaborate. Like our organization is involved in like bringing all of the organizations together and kind of start doing things that are going to actually move the needle. What's going to help kids, reduce childhood obesity? What's going to, what can we do together that's going to reduce, substance misuse, or at the very least, working in the schools, what's going to decrease the amount of kids experiencing, experimenting with drugs. Those kinds of things. So we're working in all of those different areas, but
There's lots of duplication.
there's really not a lot of duplication because we convene the meetings, we help develop the coalitions, and then, like Winnisquam has a very strong coalition up there, and it's a bunch of people together in Winnisquam, but we help, Kelly Gasker from our organization she provides the technical assistance and facilitates that work, and then they do it. We work with, drug take back, we work with, our emergency preparedness efforts. We work with the people in your community, your police chief, your fire chief, and develop the plan, and then they implement it. So we're the facilitator. We're like the backbone of community health. And there's just a lot of moving pieces, but it takes a lot to get.
So ServiceLink is only a little tiny piece.
So ServiceLink is a small piece of that, but it's actually a big part of what if you look at our organizational budget, it's a big part of what we do. Because it's what we do that's actually provides service. The others, we convene, the meetings, we coordinate these groups, but we develop partnerships. But with ServiceLink, we actually do the direct support. We're actually, providing working with the caregivers and actually paying for the respite. We're actually going to home visits, evaluating people's homes. And that's more of a direct service part.
How are you different from visiting nurses? Because if I need respite care or if I need some kind of home service, I would call probably visiting nurses.
We're not a provider.
No, we're not a provider. So what's unique about us is that we're not in it to sell any one product or anything like that. When folks come to us, we strictly provide information to them, meet them where they're at, face to face, and talk to them in that way that helps them understand the whole breadth of options that they have for any number of things. For in-home care, if you're talking to an older person, understanding
You
how
are.
young, I think. But if you're talking to someone who's trying to understand their options for staying at home or taking care of a loved one, and if you're talking, are you a veteran? Can we tap into veterans resources? How do you do that? Who do you contact? I know who we call here in our area to do that. I can tell you my name. Actually, that person just retired. We know who the agencies are. We have contacts with all those people. So for example, today, this wasn't Tilton, but I had a woman in Laconia. She called me. She had no food in her house. So she said, I really need to get food today. And at ServiceLink, I know the person at the home care agencies, and I can call her and say, listen, I know you don't usually do this, and this is what I did, but I need you to go visit her. She's willing to pay. Fortunately, she has some money, so they were able to go out, do a one-time emergency. We're going to go to the grocery store for her and pick up groceries. That's what we do, and other people don't do that. So again, where we align with public health is that we are a convener of our community resources. We're bringing all those together as a product for our consumers so that we can help connect the dots for them. I often will make calls on behalf of clients and try to make that process as streamlined as possible because it's very hard. And we're talking about people who are in crisis caring for their families, they're older, their health is compromised, and it's hard.
Can we, I was just say this little story, we have nothing to gain by, like, Chris was mentioning like visiting nurses and all that. We have a gentleman that lives not too far from here. He lives in a beautiful home on the water. He's 93 or 4. He is a retired vet. And so he has a lot of dough. They think he's worth about $1 million. And so we don't care if you're rich or poor, we're gonna help. No matter who walks through our door, we're gonna help. But this gentleman is being overserved. He has a visiting nurse company coming in that knows he has money. And so they're going to bill him and bill him and bill him for as long as they can. He's living independently in his home. So, he has neighbors that want to help him. And he has neighbors that want to cook meals for him. But this agency is kind of like taking control of his care and just saying, no, we'll do that, we'll do the cooking, we'll do this, we'll do all of this stuff so that they can, they can bill for it. We, on the other hand, we're all about, natural supports, and I know we're all about having people have their friends and neighbors help them out and help them remain independent in their home. We don't want to break those relationships off. So we have nothing to gain by telling a client they should do this and they should do that. We have to make them more money.
Thank you so much.
Okay.
Any other questions?
All right, get out of here.
Christine has questions.
Oh, I'm sorry.
I have 2 questions. Of the list of these towns, which of these towns do you have the most clients from? And then in relation to us, and then second, in all the, if this is a little tiny piece, why is Service Link picked in this situation? Are you getting funding or what?
Well, we had a reduction from service, for funding, and we actually have clients from Tilton. So when we decided, what we would apply for funding for from the town, we figured, well, why don't we apply for Service Link? We need money in that area, but we can also show you, how many people we're serving from your town. And you can, if you decide to give us funding, you can allocate that for, we can allocate that for, designate that for, to be used for Tilton. So that's kind of how we did it, because I know from my experience in soliciting with towns, they've always wanted to show that we're working with Tilton clients.
So you can restrict the funds just to our client,
No, we
Tilton
can.
residents?
Yes, we can.
How do you prove that?
We would just prove it. We would just do it and prove it if we didn't use the funding. For example, if you gave us money for Tilton, we would, charge it out to all of our Tilton clients. And then if we didn't have, if we had money left, we'd either return it, or I would make a call and say, look, we're doing some emergency preparedness work out in your community. Could we allocate that to work in Tilton for that? That's what I would do. But you can designate it for the town.
Do you use our funding last?
Would I use your funding last?
State funding first, and then ours last? Or would you just pull from Tilton funding for Tilton residents and then?
I don't know how I would do, I'm not sure how it would go. I don't think it's ever happened that we didn't use what we might have got. It's rare that we would use it, but I'm not sure what the sequence would be. I can get back to you on that if you want.
And did you, which ones of these towns do you service the most?
I would say Laconia, they're our biggest city in our county, so they absolutely are the biggest number of calls, contacts that we make. But specifically with our caregivers, I checked this morning, we're serving about 60 caregivers just on our grant, and 10 of those are Tilton residents, with 2 more who are getting put on a wait list. So 6 of those folks who are caregivers specifically on that grant program are Tilton residents.
In ratio to Laconia, how are we in ratio? Are you serving at like 500 to our 200, or, because you're asking for the same amount?
I didn't pull our Laconia data. I can get back to you with the Laconia data.
Why are you asking for the same amount?
How much was it?
2,500. Belmont, Laconia.
Across the
We
board.
just, I'd have to look, I think we're gonna ask, I think Tilton's pretty close. I mean, I think it's, I'm not
Oh,
sure.
County?
In terms of numbers?
Yeah,
that
so
we
if you
serve?
figure population-wise, it makes sense that we serve more Laconia residents,
Yeah.
just in terms of our contacts.
And Molten Grove gives you 5,300. Why do you do that?
And that's not for my program.
Yeah. Multnomah is not, they give us 5,300, and that's primarily for emergency preparedness, because we have a relationship with them that, we do training up there in Mountain Grove. They didn't want to be, they're in another region, but they didn't want to be in that region because they wanted us to be able to help them if they ever needed a shelter, or have a guarantee with them that if they needed a shelter, we would go and set up, because we have the expertise in that area. So they fund us for emergency preparedness. That money is that money is earmarked for that. So, we have some towns where we have a very strong relationship from emergency preparedness, as we work a lot closely with them on drills and things like that, and so they will be more inclined to fund us for that and not service link. So they're different, every town is a little bit different.
Well, thank you very much.
If you have any questions, here's my card, just, please, even if financial questions, just, give me a shout, and, I'm sure I have enough going on, and I'd be happy to, talk to my financial director and, have that.
Thank you very much.
Thank you.
Thanks, have a great night.
Oh, you betcha. Give you the card.
I'll get it.
Okay, yeah.
Thanks, Jim. Thank you, Jim.
You're welcome.
There's a CAP,
I didn't hear, I'm sorry.
your CAP,
We are.
And now, somebody that I know makes more phone calls.
It's very good.
You're supposed to be up there, not over here.
What's
You're
that?
supposed to be up there, not over here.
No, so I'm like, oh my
She's
God.
afraid of you.
This is just.
Yeah, but I think we have new people since you were last, so we'll around
who you,
I'm Gail Lyon for the Food Action Program.
Gail
Lyman.
Lyman, okay.
Yep, Beth Haley.
My name's Bill Morris.
Nice to meet you.
I'm Peter Oriano, how are you guys?
Jane Alden.
John Scanlon.
Christine Dembitsky.
Dick Colson.
Well, for the new faces, I'll tell you a little bit about what Community Action Program is about. Our office is located in Franklin, and the new news is we are out of our old building right now. We are temporarily located at the Franklin City Hall. The unfortunate aspect of that is we were not able to bring our food pantry with us, or clothing, or any of those types of things that we do. But our office is temporarily there while we wait for funding to be approved so they can knock down our old building and build us a new one. So basically what we do, we are a one-stop shop. We serve 8 towns, Tilton's one of them. And folks come in for various programs, fuel assistance, state resident discount program, which is a monthly discount on light bill. They may come in for security deposits, back rent, neighbor helping neighbor for disconnects on gas or lights, all sorts of different programs. And I didn't bring any brochures with me, I thought about that after I left the office. And I have a brochure that lists everything out there, and referrals to food pantries and other agencies, and ServiceLink is on them, and we do refer to ServiceLink quite a bit. For instance, for fuel assistance being a federally funded program, if anybody qualifies for a benefit, they've already paid for it 1,000 times over all through their working life. So all we do is give people back their money. And it goes towards whatever fuel type that they have, so it supports our local fuel agencies. If they do have heat included in their rent, it can go towards part of their rent in the wintertime. And the statewide electrical discount program, that is a monthly
discount on every light bill. Now, that's a year-round program. And that can range anywhere from 7% to 76% off a light bill up to 750 kilowatts. So we have a lot of these programs that we just want everybody to get their money back into. And like Jane knows and Pat knows, if you can't get to us, we will go to you. I don't care where it is. Because we don't want any barriers to get in the way from somebody to access our services. So just a couple of months ago, I did a security deposit at Burger King because that's where their car broke down and that's where they were homeless. So it doesn't matter to me. I've done it at McDonald's or whatever. So that's kind of what we do in a nutshell for the new folks. And so part of how things work is, so field assistance, for instance, a federally funded program. And correct me or I might get wrong, but so the federal funds are allocated to the state level. And that is out of the Governor's Office of Energy, which is now called OSI, which I'll never get used to. And then they oversee the program. So the community action agencies within the state actually are running those programs under the oversight of the state. And so what we do is the towns that we serve, we ask each town for a little bit of money to help keep our offices open to run those programs. And so that's why we are here for today.
And I oversee all of our 6 area centers, all of Belknap and Merrimack County, so our Franklin area center is one of the 6 that I oversee. And I like to come to these things because first and foremost, we just want to say thank you. Because first of all, you guys have always supported us in the past. When we have asked for increase, you've given us those increases. We're not asking for them this year.
How much are you asking for?
Yeah.
I don't have a request here either.
Yeah.
What?
I have one copy.
We have this, but I haven't seen any requests
Oh,
on
it's
there.
right in here.
Oh, it's on the bottom paragraph.
How much is it?
26,000.
26,000.
Same
Oh,
as
okay.
last year.
Yeah, same as last year. And then on the back of that, you'll see the services broken down on one more page.
So I'll tell
It
you
will just show
why.
you the services.
When you
Please do.
Yes.
Please tell me
So-
why.
Yeah, it is. And so out of the 8 towns that we serve, Tilton happens to be the second largest town that we serve. And so therefore, we do appropriations according to the populace of that. Franklin, because of where we're located, is the largest amount of population that we serve. The third one in line is Northfield. So that is why it may seem very high, yes.
What is Franklin's request?
Well, unfortunately, years and years and years ago, we used to get 25,000 from them. And it was 5 or 6 years ago, there was a new city manager who cut us to 0. And so we've been trying to climb back up. Right now, we're at 6,000.
In
that what?
Northfield, how much is Northfield?
6,000. I didn't bring that off the top of my head, I'm sorry. But they're
6,000.
Franklin 6. I
And
know.
then
And unfortunately, we do have that in some other areas where some of the bigger cities actually pay the least amount, which is very unfortunate. And on our end, the only thing we can do is try to work those relationships and show them the services that, we provide.
Where else are you guys getting funding from?
So we get funding from the feds, and it comes to the state, and then the state gives it to us.
How much do you get? How much percentage of your funding you get from the
It
state?
shows right here,
66
from the
66%
feds
federal.
and 34.
And then 34 from the towns. And that is on your second page at the bottom.
And one of the things that's unique about, because there's caps everywhere in the state, there's 5 caps that cover each territory. And the difference with ours is that we are able to keep our area centers open year round. A lot of the other caps don't. They are very limited, they have very part-time, and it makes it more difficult for people to get those services. And because we have support from the town, we're able to keep ours open year-round. And when we're not in the town hall, we do have a food pantry and clothing pantry and those types of things.
Just looking here though, it looks like we have 26,000, we'd be over, or about half, or essentially a little bit less than half actually, of all the town share, just us. Because it's 55,500 All the towns.
So we give you last year?
26,000. Yes.
So we were half your funding last year, essentially.
Yep.
Yeah, Northfield's one of my higher ones too. So in relationship to what we offer, what we ask for the amount from the town, is in return, we do give $208,000 worth of services back to Tilton residents, which goes into the local economy, whether it be the fuel companies, landlords, or whichever. And if we weren't here, your welfare office would be inundated. And Heather and I, we've worked closely for the past 20 years all the time, so that we can cover, so that it will be the last resort.
Cool.
Out of this 208, only 3 items show the number of households or persons, so like electric, is this is 53,000, but it doesn't say Tilton residents.
This is just Tilton.
This one is,
All of
yes.
these are just Tilton. This is just you guys.
What's your total, in kind from all the towns? You have a, now this, you're saying 208 for Tilton.
That is
So I'm
just
just
for
curious
Tilton, yeah.
for all 8 towns, what is
Yeah.
the total for that?
How much money, how much services you need?
Yeah,
The
yeah.
amount? Okay.
Yeah.
I do not have it off the top of my head. I could get that to you guys.
Yeah.
I have, every town gets
We
it.
can show you every town.
Sure, yeah, we'd like to do that.
Absolutely.
Okay.
Yeah.
You got it.
Is there an email that I can send that to?
Yeah, Johanna,
Sewer, SEWER, at tiltonnh.org.
No, I know.
You couldn't do one for budget, huh?
No, it's not the budget.
Wasn't in the budget, huh?
Children and
Sewer at tiltonnh.org.
And we've done that for other towns. We've given them, we don't have anything to hide, so yes,
well, you've usually
absolutely.
given it to us, I don't know why.
Yeah, well, not sure.
Not recently. We didn't last year either. Not like full, well, maybe we did, but I can send that to you guys. Yeah, every town gets this exact packet on how much we're requesting, summary of services.
Absolutely. Yeah.
Thank you guys so much. Any other questions?
Any questions? Yes.
So they asked for a breakdown of how many people in the other communities that are served, and I said it's hard to hear
Sure.
from back there.
So,
But my question is, how much does each of the eight communities pay? And I heard 6,000 from Franklin.
yes, and so what we're gonna do is we're gonna get to that,
Okay.
because we're gonna be able to show you what each town pays and what we out, and how many people within each of those towns get the services and for what programs.
What I'll do is I'll just send you this exact packet from all the
Yep.
towns, so we'll say how much we request,
Yep.
and all the breakdown and all that. I
Absolutely.
can send that all to you.
You bet. You bet.
Any other questions?
I do, I'm sorry. I didn't know.
No, that's okay, good, good.
When people apply for fuel assistance,
Yes.
and they own their own home, does that home become an asset that you have to
Absolutely not.
consider?
We do not have, no, we just look at income.
And does the car, so
No.
it's strictly
Nothing.
income?
It is just income. So the matrix that is what's developed into what configures their benefit is it goes by how many people in the household, what kind of heat they have, as you know, sometimes propane is one of the more expensive heats, electric heat's like the worst, all the way down to coal is the cheapest and pellets. So that's a matrix. It depends on how much income is in the household for all of them. How many rooms are in their home and what kind of home, whether it's a mobile home or a single-family house, apartment building, things like that. And there's one other that decides the matrix. And the benefits range anywhere from $75 to a little over $1,500. Yes.
I also serve as the health officer of the town, and I have tenants
Yes.
that recently this week have asked me, or have said to me that they can't apply for fuel assistance because they won't qualify because they own their home.
No, never, no,
Right.
no, never.
And some tenants are afraid because they own their car, would be their
See,
assets.
and you know why? Because the state did that.
Okay.
They did, I don't know if they still do it or not, but if you got a car, well, no food stamps for you. So they're probably still scared into that aspect.
And they are, you're correct.
Yeah, yeah.
So while you were here, I thought you
Everybody, anybody.
We always
Apply.
tell you, come in and apply, even if
So
you see the matrix, so you see.
on your website.
the landlord form and some of our forms are, but all they have to call us for an appointment. So the other thing is, so say they're over income or too rich, as I kind of put it sometimes. There are other programs out there for them. Always other programs. And so if you're, say for instance, you're over income for the 30-day look back that we do. Oh my God, we can figure out from year to date. We can get you stretched out, see if we can get you qualified that way. And then if you still are too rich that way, we can do what's called a 365-day look back. Never say never. And if it's an elderly person and they're over income and they need fuel, we will dip into some of our other funds that we have. Absolutely. So we want to see everybody and anybody. Absolutely.
How do people know to call you? I mean, how do, you know, I like to know how people are referred to you. Or
Well, I do outreach, and I noticed downstairs the brochures are gone.
Okay, so you have brochures in every town hall that you
I
serve?
do, and
Senior
post
center,
senior
library.
centers, word of
Okay,
mouth,
great.
our fuel
Has
companies.
a great, has a,
No, that's.
Fuel
companies.
That's
Yeah.
it.
Oh, they're great, they're wonderful.
I know you've been around forever, so might not be.
1982.
well, she's been around forever.
Oh.
Been around here way too long.
20
With
years.
them.
20 years.
20 years.
20 years.
You know Les Gumio?
Excuse me?
Les Gumio, have you ever heard of Les?
You may.
Gumio?
Les.
Les.
You know winterization, Les?
Yeah, he used to.
Oh, yeah.
Used to work for you guys.
Oh, yeah. Back in the time when we had red.
Okay, yeah.
Yeah.
All right, any other questions?
Well, while you're waiting for your new building, you can take your food pantry and you can take some other things. What is done with this? Is it somewhere else or you
No.
just refer out?
It's just, we refer out.
The USDA food that was always going to the Franklin area center has been reallocated area, the surrounding areas. So still in this area, it goes somewhere else.
What happens to those people who depended on that?
So, all the other food pantries are still around in the area, and I have spoken with all of those food pantries to let them know there's one less food pantry. They've all been accommodating, so far I haven't had any fallout for that. But hopefully this won't take very long, so that we can make that new one. Totally, absolutely.
There's gonna be a much bigger building, footprint, gonna be a lot bigger?
Yes, well, it's gonna be a different configuration, so the use of the space will be much better. And we even had it in the budget this time around. It was over $10,000 a year just to fix it up and keep it up. So we've cut that way even in half is our projection of what it's gonna be, so it's gonna save a lot.
When do you expect in the new building?
Well, we haven't got the crystal ball back from the shop yet, so, don't know.
Next year?
Yeah, definitely sometime next year. We had some issues with some of the grants that came through, because you guys are thinking about grants. We had federal grants, we had state grants, and we had town, we had city, and of course, no one talks to each other, so it's been quite a nightmare on trying to get funding. But I just, actually, this is news to you, I just heard that we just got approved for our last bit of funding.
Oh,
So,
so that's the last stretch.
it is. So the next thing is,
Hallelujah.
we already know the place we're going, who we're working with, so it's just also dependent on weather, on
Yeah.
how that's gonna go.
So it's gonna be a
during the
slab,
winter.
it's not gonna be a cellar this time around,
Yeah.
so that'll be good.
It'll be a really great, it's gonna be so much better for the people we serve.
Now, in the past years, we still doing, I think you've started a thing with vegetables and farmers market type things.
My pantry always did,
Yep.
yeah. Yeah, we always had fresh fruits and vegetables,
People
local farmers.
donate those and you help distribute them, people need them.
Yes, and the other thing is, I got a pet food grant a few years ago from the Franklin Savings Bank, because I did a survey about those with pet food. And unfortunately found that over 70% of our elderly people will go without their medication to feed their pets, so. So I've always offered pet food and actually drove it around to the elderly complexes and just kind of dropped them off that way, so. Wherever there's a way, we'll get it out. Yeah. Okay, great.
Great.
Thank you so
Thank
much.
you very much for all your
Thank you.
support, and I'll make sure
I
to
don't think they're familiar
email
with
that to you.
I think they need some assistance.
You got it, Chief McCall.
Yeah.
You got it. Thank you. Walter.
Thank you, Dale.
You got it.
I read your night for me time, because I don't want to screw it up.
Well, I'm glad.
You were right.
Okay. Perfect, I will get that to you probably by Monday, by the time I get everything scanned and sent to you.
I'm going to request that Heather come in this year. We didn't have her last year because she'd come in, it was a whole group of budget people. But since we have new budget people, I'm going to request that Heather come in, so I'll make arrangements for her to come in and talk, because one of the things that you don't see, I think, when we have all these people interviewed, is how much our town relies on some of these other services. And I'm talking CAP in particular, I'm not talking Service Link or any of that, I'm talking places like CAP. It's CAP that really provides the services to our people. And if you start talking, if you look at our welfare budget, it's almost nothing compared to the people we service. And that's because Heather makes use of all the organizations that we fund to take care of our citizens. And one of the ones that she makes so much use of is CAP. So $26,000 seems like a lot of money in terms of the services they provide to our citizens. When we have people whose houses have burned down, and it's CAP that we've gone to. They provided dishes. One time, remember, Pat, when we had to get dishes and we couldn't find dishes? CAP provided the dishes. It's amazing some of the things they do. So it would all be on our shoulders, you know. And what everything Pat said is true. It all comes down to us for things like Service Link. I mean, I wasn't kidding when I said, when are you going to buy more phones?
The only thing,
They asked for $2,500 because most of their services are phone service through the phones. And she went on to say there were other things too, but I mean, we go out, they may do outreach for drugs. We have to go down on the street and see people who've overdosed. You know, those are the people that we see the benefits to. And, you know, I don't know, I'm still kind of shocked about that $2,500 for Service Link.
I don't mean
There's
to
only 2 towns that actually give them money.
Yeah.
Service
Well,
Link,
and I know what they need to go to the towns who've given to somebody else once before, so that's why they did it, but.
But Service Link has a purpose, a tremendous purpose, because people that have disabilities and handicap and Alzheimer's and dementia patients in their home, and they have nowhere to turn to, it's only a phone call away. They dial 211, and it's only a phone call away. If anything, it's a resource to get them into the right direction. And that is so invaluable to everybody that's out there that's so desperate in need of that. But you're absolutely right, to come down and ask for the state, it's been under Health and Human Services for as long as I know, and it should be funded by
And it used to
them.
be completely federally funded, that's
Yeah.
how it started.
And the American
About
Elders Act
5
used to
years
fund it.
ago, it got cut,
Yeah.
federal funding, and that's why they don't have any money.
Right.
can we just talk about like the CAP though a little bit? I get that they're a super helpful resource in the community, and I get that we have welfare and stuff, but what is our welfare budget a year? And we're giving them $26,000. That's a quarter of their entire budget.
They're giving
One-
200,000 in return.
Yeah.
In
So
services,
think of that,
in
yeah.
services,
Right.
that they have made up the fictitious price to, essentially. Like, there's no, like, one person could say this is this many services, I could say it costs this much for the service because it's how much I charge for the service.
I don't think that that's a fictitious.
No,
I certainly
let's put it this way, I was in
question.
an accident 2 years ago, and if it wasn't for CAP, I wouldn't have had food. I wouldn't have had anything.
I get it, but should we have to front 26% of their entire,
Well,
say,
it's
budget?
almost 50% of their whole.
Oh, no, that's just from towns. That's just from town. But overall, they have $200,000 they're getting inwards, and we're paying 26,000 of it? Like, I don't know.
We're getting 208,000 in services.
Yeah.
For our.
For $26,000.
For our residents of this town.
And then Franklin next door is giving 6,000. I just think it's a little
Well,
scaled.
it'd be nice to see how much services Franklin's getting, yeah, I mean, that's why, that question's a good question.
I get the cap's like super important, but I just think it's kind of, I know they're helping our community a ton, and I know that the money's going good, and it's not miswasted like a lot of other companies, but I just don't think it's fair that we're putting the burden of that on the taxpayers.
One of the things to look at, and Heather's a real good one to tell. In watching the budget over many years, we've cut back on our welfare budget. Our budget has gone down by, I think, about $50,000 a year for the last 4 years. Maybe even, is that about right?
It's gone
Like 4 or
down.
5 years.
It used to be around $100,000 at one point.
Was
No,
I
about
thought it
70,
never
I
was
think.
100,000?
No,
Years ago.
Years ago it was 10.
no,
So this has dropped down a lot.
120 years.
And Heather
Before
is
that.
great. Heather is a really big asset because
80 at least.
Heather doesn't write checks or just give out money. She refers people to all these different things and says, did you check this or that, puts in that. And I know that she works with the CAP program a lot, so Heather would be a person that can tell you how much that affects our budget.
Take a look at the surrounding towns and what they pay for the welfare in their
Yeah.
budgets.
So is Heather like a service link
No,
in a local
No.
situation? No?
She's just purely our town welfare.
She just has years of experience.
Well, I mean, but she's doing a job that Service Link kind of does.
On it.
she does the
Yes.
same job that Service Link does,
And
if
she
you will,
directs
because she
people
has a list,
to areas where
she
they
has a list
can
of
help.
contacts
Logo.
that she gives
Right.
out,
Right.
She keeps it to our town.
and that keeps
That's
it to the
what we
town.
need here.
But if we didn't have Heather, I mean, that's why other welfare budgets are so high, they just dole out the money. You go to Heather, she doesn't just
No.
dole out
Yeah.
money, she uses the resources, she uses the people that we help.
Our
So what happens if we
surrounding,
don't give this money?
our surrounding
That's not
towns,
why, I'm sorry, that's not why
Sometimes you
Heather
legally-
saves money on the budget, by
sometimes
using those
you're
resources.
bound to do it.
Heather saves
This
money
time
on the
isn't one of those,
budget
though.
by only
Well,
serving
welfare
people who
is-
qualify
cap
for
isn't.
welfare. That's how Heather saves money on the budget.
But your alternate is you're bound to.
Which, that is totally, I'm just,
Yeah.
want to make sure that we're paying our fair shares for getting the services we are. I don't want, Franklin, maybe they're doing it good and we're not, you know, maybe they're paying $6,000 and getting a ton more services than we are, and we're, you know, basically footing the bill for them. So I just want to make sure that's, you know, I get that they're a good service, they provide a lot of service for our town, and they say they provide, but I just want to make
You
sure.
might want to check with the town manager in Franklin and see what kind of programs that they've instituted in place of CAP, so that they don't need their services as much as Tilton does. We don't have anything in place of CAP that's going to replace anything in
What are they really
except
doing?
our welfare department.
What are they doing right now? Because now they don't have a food pantry, and now they're doing basically the same thing as Partnership for Public Health was, their service line.
I don't think you know what CAP does if you're saying that.
Well, they just said they don't have the food pantry open now.
They don't have their food pantry open up, but they don't do the same thing as Partnership for Public Health. They don't,
Yeah,
they're
yeah.
completely
They
different
do
what they're
fuel
doing.
assistance.
Yep.
You know, it's up right here on the ship. They do.
They're out in the
electric
field with elderly.
weatherization.
And they also refer people, they said that here.
But it's-
Homeless housing services, yeah. It's a big thing.
You're
Yeah.
looking at elderly, Meals on Wheels, you're looking at the senior center, and you're looking at,
I think Heather is a.
Fuel
real good one for this
assistance,
conversation.
I'd love
Everybody
to
said
have Heather come up
Because she'll
and tell us
say
how
Yeah.
all these
how well they
organizations
work
mesh with
with
us.
us.
She'll tell you
or if
the
they
good
just
and bad.
prick you up.
So I'll keep in touch, I'm gonna have to see Heather tomorrow, to have a check for
I just want to make sure that what we're paying is not less than we'd pay for welfare. So we all know that the welfare cost would go up if we didn't have CAP. But how much would it go up? Would it be more than we're paying for CAP or less than we're paying for CAP? That's really what I'm trying to get at the end of the day.
it's about,
Because welfare, if somebody couldn't pay for their heat,
Welfare.
we would have to pay for it.
We do pay for heat. We do.
Sometimes.
we
So that's
do,
what would
in
be,
some instances where
let's see
they
what's
don't
with that.
qualify, right?
That results in that. You know,
that's what
like
I've
you
been
said.
trying to weigh in my head, is 26,000, do we really get 20? I get they give us $200,000 in services, but what are all those services? Are every single one of those paying for heat? No. But they're also, you know, going out, checking on people, doing things, and I get that part. But we do have a town health officer, we do have other ways, you know, I don't want to put a bunch of stuff on Catherine's book, but we do have other ways to handle this. There is more than just one organization cap.
They all, in each one that you're speaking about, health officer, welfare department, CAP, they all have their own limitations and parameters within their own jobs.
Equally, yeah.
So they overlap some, but they don't duplicate some. Some of them, like CAP, there may be a duplication in that they both give out fuel assistance, but Heather's not gonna give out fuel assistance when CAP can. CAP's gonna be their first tap, Heather's first tap to it.
The other part of that is our welfare officer is part-time, because we don't have to have her here all the time. And there's a few organizations that do help out the town, that actually outreach. They kind of cut people off before they come to the town and say, and then they send them to the federal stuff to get it, say, don't come to the town. So, the whole welfare is a big part of how a lot of these little things work. And what you said, that how is the balance on that? Does it go like this,
Right.
The more they supply, are they actually cutting back our welfare?
Just so I'm clear, so everyone's kind of in like the same cahoots about Service Link, that it's not. Like, I don't know, I just feel weird about Service Link. I don't know if we're voting on this tonight or anything, but
No, we're not. But
They could get the whole picture.
Just make your notes.
yeah, I felt like Service Link was here because we'd given to something before and we were a good hands to tap.
Did we ever fund them?
Out of 250 people
No,
serviced,
but
200 were phone calls. See that?
Yeah.
that's a little.
To be honest, I think that, I don't know, and I may be wrong, but I think they came to us because in the past we've given to fundraising for another organization that
Shelley does.
Shelley has done. And so we were a good one to tap. That's what I think, but I could be completely wrong, but I believe that that's why.
What are we gonna do about the concert?
We need to discuss the concert. We have a policy. We have a policy that if someone doesn't show up, we don't fund them. We have somebody who didn't show up tonight, pretty vital to our community.
Should we wait for
Did they get the notice
reason?
the last time?
Did you not, did any,
Something could have happened.
Yeah, something could have happened, so I don't,
did you text Allison?
I texted Allison and I have not heard from her. Now, that's very unusual not to hear from Allison right away. So I'll try to call Allison tomorrow. So,
Maybe we don't send these notices certified, do we?
So we're making a special kind of exception for the Island Concert Series person for not showing up?
we're gonna find out what the story is.
Just making sure.
So we could have.
We just shut down some other people right away without any discussion.
Madam
so I
Chair,
should
can I
do
ask
that.
a question?
Who did we shut down right away?
It was a couple of nights ago that someone didn't show up, I can't remember. They didn't come on time, I don't remember who it was. We just didn't even have a discussion, about it. We moved right on to the next person.
Joanna probably knows.
I don't remember
I
that.
think it's.
No, they end up coming in later, never mind, I was wrong.
Yeah.
Can I ask a question? Where was that, how was that question asked earlier today that you voted on with Old Home Day? Because they level funded, you decided that because it was a town-funded,
No.
organization, that you decided that they didn't need to come in?
Does
And yet-
Old Home Day need to come in this year?
And yet we have
They had a
island
request.
concerts that for the last 15 years have been level funded and they serve only one purpose. and
Well,
that's
that's
the
why we're not
community.
voting.
Well, they put a request in,
Making a
they
decision
didn't.
tonight.
Who didn't?
Did the
Well, they
islands-
requested a waiver because Northfield waived them if Island Concert could put the same
Yeah.
request
They didn't miss their date.
Island Concert submitted a
in.
form,
And the
right?
date, yeah.
Did they
Yeah.
know that they
Well,
could submit a
no,
waiver
yeah,
not
well-
to come in?
Old Home Day is in the form.
Did they know that they could submit a waiver not to come in?
No, but
I don't think that's
they
common
weren't,
knowledge.
they weren't
yeah.
supposed to come. What time
They
was
weren't
it?
due, they weren't due here
Was
yet.
supposed to
Didn't,
come
They
in.
were
can I get a
due.
clarification on
7:15.
something?
Yeah.
They're not due yet.
It was my understanding that if somebody didn't submit the form by October 1st, that we wouldn't fund them.
That's
That
how
they
it
had
was
to apply.
last year.
Yeah.
That's what it was,
Yeah.
and it wasn't showing up.
Yeah, and but we
Check with
didn't
them.
fund Red Cross because they didn't show up and it was not the
That's
first
what it
time. That's what it was.
They didn't show up, they didn't collect your check.
Pat, give us one of those forms, I don't have one.
What she said was.
This
We
is
don't
the
have that form.
form.
I don't have that form, or have. Do we have those, that form?
That's all we did.
I couldn't find one, I didn't have it.
No, it's only a typed sheet. There's no,
Oh, no, that's the other one, this is Cap.
Second meeting.
Yeah, they don't didn't get one, I don't have one for these guys.
Just they were requesting from it.
But I don't have one for Cap. So did they send one?
If you read the top of the form, if you read that paragraph,
This one?
any of these forms? Anybody read
by
that?
October 3rd.
Yeah, I know, we made that point with the Red Cross too, I think.
So it doesn't say if they
It
don't
just says
show up.
we may not accept, it doesn't say
Yeah.
we will not.
Yeah.
But maybe we could get Cap to send us one of those forms.
I thought I had one. I thought we got two last time, or, and the Cap was one that we got two of.
Nope, don't have it. Which one says negative? Yeah.
The only thing that I saw with the cap was in their other costs, their building maintenance, rubbish, snow removal, and cleaning. But they're presently in the city hall in Franklin, which provides all that.
Yeah.
And it was $8,000, I don't know. And utilities.
And then we can
So
ask
I
them
don't-
if the building maintenance is their
Liability and
share.
fire, liability and fire insurance, is that being burdened onto cap since they're just temporarily using the town hall in Franklin for city hall?
Oh, they still have to pay on the other building that still exists.
But they'd also have to identify their own employees and have their own liability.
Right.
So they wouldn't have supply insurance for the city hall, but they have.
But, are they doing cleaning or what, so, it's the same amount, hasn't changed, so, I don't know if they've adjusted that for.
No, they don't.
And some of that is for the cost, the utilities and everything is still for the, what do you call it, the building, trip center.
Yeah. Trip center.
Some of that's for the,
Oh, they fund the trip center?
Yeah.
yeah,
That's
yeah.
good.
That's, some of that's maintenance and plowing and all of that, and liability insurance is, the Betsy Rowell Center is what they call it.
It's the old trip center. Here.
That's on the cap.
Anything else?
As is our programs at Tilton City's
Oh, the cap funds that?
Our
Yeah.
CAP program director is funded by the Community Action Program as well as our meals up at the senior center. All the programs that are up there are funded by community
Now, does
action.
she put that in the budget here, because she doesn't even have that? I mean, she put that,
I'm not sure where she would put it.
or is that directly on a separate sheet to the district? or something?
865 meals.
Has she got Meals on Wheels on that?
Because it's,
Are they still doing that?
Not in Meals.
oh yeah,
Yeah.
every day.
Neighbor helping
Just
neighbor.
don't have the pantry anymore to put them together.
Meals on Wheels,
They-
they go to Tilton residents, Meals on Wheels go to the senior center as well.
And they-
So these guys are still delivering food even though they don't have,
The pantry is
Pantry
different.
well, the
The
pantry's
pantry
still open.
It's done in
Oh,
concert.
just, okay.
Right, and their surplus food, which the government surplus food is done at the town hall. So they still do that service.
Their building is condemned or should I ask?
It's not
It was
big.
way too small.
Well, that's what it was?
It's just a small building, it's probably the size of Catherine's office up there, in a bathroom, that size.
If not, I think it's a little smaller, actually.
It's not very big at all.
I know, and you look at all the stuff that they do, and that's one thing that amazes me, look
It's terrible.
how much the director is getting paid with old salaries. It's,
Yeah, she's not getting paid that well.
oh,
I was going to suggest you might want to, when they get their, when
Yeah,
they're
that
in the
includes
building,
insurance and
you
everything.
might want to take a trip up there. You see infants all over the place. They have, that's where WIC is out of there.
But I can remember going to the, Franklin, when they were up behind the companies down there.
Oh, right behind the church, right?
Yeah, and they just had racks and racks of clothes.
They
And,
do.
and farmers were bringing in baskets of vegetables, and people were showing up to take.
And there's a
And
table
she was,
with all kinds of stuff on it.
that was about the size of two of these tables, and they, a desk in there, and found that doing all the food, the fuel forms, trying to get people to fill out the forms.
I thought this was interesting. We have a food drive every year for Vicky Bergen, and when I delivered the food to the Catholic Church this year, he was telling me that he really didn't have enough food anymore. And then I went to the Congregational Church, and they were saying if it weren't for that food drive we do, they wouldn't have enough food all year. And the reason, this is very interesting to me, because I said something about it at the school, I don't think it did any good. But the school around Thanksgiving time used to have a can drive. They don't do that anymore. Instead, one of the teachers decided they would fix baskets for elderly for Thanksgiving. So they do that now instead of the canned food, and as a result, our food pantries run out of food. I found that very sad.
The food pantry serves people year round.
Not
What is
just
Fred's
Thanksgiving.
cash with cash and cans? What is that service? He raises a lot.
He does.
I'm not sure. At Laconia, is that the cash for cans?
I think it's Franklin.
Is it just Franklin?
Right.
Because
Just
that's
Franklin?
It's a radio station, but they go all over the place.
Yeah, it makes 94.1.
Yeah, yeah.
I think it's several.
Yeah, I think it is.
But I did, I think, well, I'll entertain a motion.
So, to adjourn.
All in favor?
Second.
Aye. Opposed?
You need these back.
It'll be the first time.
Yeah, I've been up there forever ago, so.